Hello loves, once again we continue. In the previous video I talked about differentiating the UTI and the yeast infection. Now today I will be specifically talking about the urinary tract infection. Then on the other video I will talk about the yeast infection. Now, urinary tract infection is just a general name trying to cover some three types of conditions. Number one, we have pyelonephritis, or this is the infection that is affecting the kidneys. We have cystitis, the infection that is affecting the bladder, and we have the urethritis, an infection that is affecting the urethra. Now, depending on site or depending on the affected site, the signs and symptoms are totally different. When we talk of urethritis, this is when we have issues with the burning when you are urinating. That is the main differentiating factor. When we talk of the cystitis, this is where you have an incomplete emptying of the bladder. You will have you have a persistent urge to urinate and keeping on urinating several times. Another one that is a differentiating factor, especially when we check it under microscope, you realize that there are some blood seen under microscope. That is when it is affecting the bladder. Then we have pyelonephritis, where people will present with the flank pains, or in other ones, the pain just below the ribs. People also present with headache, they present with the fever, they present with the chills. Sometimes, if it's severe, they can also present with dizziness and shivering. So those are the classical symptoms depending on the site that has been affected. Now, when we talk of the treatment are many, but we try to treat this infection with only antibiotics and some of the painkillers if there is pain, and some analgesics in case you have any fevers. For example, we can try to use amoxicillin, azithromycin, nitrofurantoin, cefixime, cephalexin, amoxiclav. We can use erythromycin. We can use doxycycline, we can use septrin. So in this UTI, it has a very wide range of treatment that can be used to treat it, but in most cases we treat it depending on the severity of the disease. All right, because if the disease is severe, we cannot manage it as it's mild. If we notice that the disease is severe and we notice that it has been recurrent, then the treatment of this is so much integrated compared with the mild presentations of the condition. So that is majorly a UTI, and you need to capture this so that next time when I talk about the yeast infection, you will now live to differentiate between the two conditions. I will also say that hygiene plays a bigger role in preventing you from getting this infection, and also taking a lot of water.